This is a setup with the pacemaker and the measurement apparatus that we talked about before, including the oscilloscope that's measuring a nice pacing signal at 2.4 volts in exactly 60 beats per minute. And this is our simulated cardiac signal, which is off for now. If we turn it on, we notice that the pacing has been inhibited, and if we turn it off, we notice that the pacing starts again, because the pacemaker has been put into the VVI mode. That way we can observe that sensing and pacing is happening as expected. Now let's try to interrogate the device. Prior to this session, we have run a long RF session with the pacemaker, so now only wand telemetry is available. So there's no communication over RF, although we were communicating over RF to the programmer, which has exhausted its energy budget for that particular interface. The interrogation is now completed. We're still over wand only, and while the telemetry dump was happening, we can verify that pacing was occurring normally. Again, if we turn the cardiac signal on, we have pacing inhibition, and when we turn it off, we see pacing resuming. Now we are going to program the patient name, and there we go. We have the communication lost message to the pacemaker, and we can verify that the pacing is still continuing in that case. Again, if we do enable the simulated cardiac signal, we see pacing inhibition happening on this line, and then when we turn the simulated cardiac signal off, the pacing resume, just as expected on the clinical side of the pacemaker, although there is no telemetry going between the pacemaker and the programmer.